Hey, everybody. Thanks for tuning in to Charlie Mike, hosted by me, Mike Buchanan. Hey, it's a podcast here for you to stay up to date with all things VA, while at the same time getting to know veterans and others who are either continuing the veteran mission themselves or helping us continue our mission post-service. So today, we're going to be talking to a few people about the whole health program that's at the VA. So you want to introduce yourselves?
Absolutely. Karla, you want to go first?
Sure. My name is Karla Cauldwell. I am so thrilled to be here with you. Thank you for your service. Thank you to your families for your service. I am the healthy living lady, and I'm so excited to be here with you today. Thank you, Mike, for letting me show up.
And likewise, first of all, thank you very much to all the veterans who have served this great nation. 2022 hopefully will promise all of us a great year ahead. I'm Hussain Haideri. I'm the section chief for ambulatory medicine at Barnum and Plano locations of the Dallas North VA setup. And I am passionate about whole health. So Mike, so thank you for giving us the opportunity to share our passion.
I feel like I'm going to get fired after this podcast because they're going to be like, well, they're so much better than you. Like you both have so much.
Not at all.
Not at all. We're catching up with you, Mike.
Okay.
We're trying real hard.
Yes.
Well, sweet. I appreciate that. All right. Awesome. So let's kind of get started. Like, why don't you just give us a brief overview of what whole health really is?
Sure. So that's a great question. And I don't know if I can even do justice answering it in a very short span of time, but this is what I would say. So when we were growing up, I would always hear this line which would say, health is wealth, right? So what is health? Health is not just about going to the doctor and getting blood tests and being told your diabetes is under control. It's about all of you. It's about your health in terms of your physical health. It's about how you sleep, how you eat, how you interact, what you see around you, what's your relationships like. That is the whole of you. And that's the gist of what whole health is. It talks about you being in the center and everything revolves around you and influences how healthy you stay. That's whole health.
Sorry, I had myself muted. I forgot. I tried to mute myself so you don't hear me breathing. So no, that's a really good explanation. Do you want to add anything to that? Or was it just good enough?
I love what Dr. Haideri said, and I just love the opportunity for our veteran to be at the center of their care because our veteran is the expert in the room. We have expertise, but our veteran is the expert. But we have to draw that out a little bit because in healthcare, we've been so used to the clinician driving care. And at the VA, we've recognized that's not the best way. We really need our veteran at the center of their care.
Absolutely.
Yeah, I can't agree more. Just being a veteran myself, I can't agree with that more. I think it's extremely important to listen to us. There's been times to where like let's say I have an outside doctor other than the VA, right? Sure. Because why not? I mean, if you can have both, why wouldn't you have both? I just feel like I'm playing with all the cards that are dealt to me, right? So sometimes even when I go to that doctor, I'll say, hey, this is exactly what I feel like is going on with me. And they'll be like, all right, let's test you for that. And then they test me for it, and they're like, that's exactly what's going on with you. So like 9 times out of 10, I usually nail it right on the head. And I feel like other veterans could have that ability too if they knew what they should be looking for, right? And if they were actually able to be more involved with their healthcare.
Absolutely. And somebody like you, we have lots of veterans who do that, have a provider here at the VA and a provider in the private sector. My goal is show them how taking charge of your own life through health makes you so much better in terms of being able to do what you like to do, because this is about you, right? And that's where I think VA has the edge, because we have the opportunity to get you in the driver's seat. We are just there to help you navigate through the directions. You're in the driver's seat. You tell us what you want out of your life, what you want to see in the next 5, 10, 15 years, and not just how your health is concerned physically. How do you like to sleep? How you like to eat? What you like to visit? Who are your friends? What gets you satisfied in terms of spirituality? What gets you the peace of mind? And we are there to provide all those resources in the best of our capacity. And that's what the VA Whole Health Program does for you.
So let me ask a question. Speaking of all of those things, that's a lot to really know about oneself, right? I mean, if you really think about it, like that's a lot. Like, I don't even know if I know a lot of those things about myself. I feel like I have like an inkling of some of those things, but like that's a lot of you really need to know who you are.
Sure.
Kind of questions. Do you have someone that helps the veterans figure that out?
Absolutely. So you hit it right on the head. So what we do through this is you have like a coach. Remember, if you go to a healthcare facility, they assign you like a coach.
Sure.
Well, we have a whole health coach, and the coach sits you down and goes through what's called a personal health inventory, so that you know all these. I agree, there's a lot of areas to cover, and these are areas that's around you may not have even paid attention or notice. So there's a circle, it's called the whole health circle, and it covers all these areas. It talks about spirituality, about surrounding, about personal development, about what you eat, about rest, about meditation. And this whole health coach will go through all of these, not in one sitting, in a few sittings, and let you explore and then kind of prioritize what are you looking for? Where do you need the most help? Where can we empower you more? It's not about us providing, it's us just facilitating and empowering you.
Mike, I wanted to share that along with what Dr. Haideri has just said, which is critical, is that if you are unable to access a health coach, we have the most amazing portable health coach.
There we go.
On our phones. So you can have your own health coach on your phone if you're not able to visit a clinic, or if you prefer to receive care at home. You can get to know yourself in all of these different areas with the use of your phone and an incredible app that the VA has created.
There we go.
Great. That's great, because I know that, especially since after the pandemic was shall not be named, because this is going to be on YouTube, and YouTube hates that word. Even if it's used in a medical sense, they just hate it. The algorithm just hates it. So I know that after that, the veterans have definitely started bouncing more towards or leaning more towards virtual care.
Yes.
I think, and which is great. I think that's wonderful that Whole Health has really gotten on board with that. I really do like the idea. I like the idea of holistic healthcare. I always have. I think veterans are really going to appreciate the idea of holistic healthcare. It's new for us. It's new for veterans. Veterans, I don't know if you're familiar, but like when we usually get healthcare, it's usually like a wham bam, thank you, ma'am. That's how our healthcare system works in the military. So you walk in and they're just like, "What's wrong with you?" And you're like, "This," and they're like, "Great, take this and get out."
Right.
Like it's very like quick, dirty, and simple, right?
And I'm so glad you brought that up, because when I'm talking to providers, to people who are involved in different segments of healthcare at the VA, and they ask me, what exactly does Whole Health ask you to do? All it's asking you to do is exactly what you just said: change the conversation. We are not changing the topic. We are not changing the gist. We're not changing the message. We're just changing the delivery of it.
Yeah.
So we're talking about, look, we let you talk for a change. We let you, the veteran, speak to us and tell us what you want, and then let us help you through that. So it's gone are the days, because if the way we have it set up right now, as you were saying, even in the private sector, I worked 18 years in the private sector before I joined the VA. So I have a very good way to compare how it was so one-way driven, where you came to me and I was to tell you this is what you need to do. No, we are just changing the conversation to say, what is important to you? What do you want out of your life? What's special and what means the most for you in the next few years? What do you see yourself doing in the next 10 years? And then let me prioritize and offer options. And as Karla was saying, not all of these options require you to be physically in a doctor's office 24/7. You could do this in the comfort of your own home with all the electronic support that the VA is creating for you. What do you say, Karla?
I say yes, please. And one thing I want to share is that I am a Marine wife, and every resource that we're going to talk about today is something that I use for my family, because I really believe that if I'm going to try to sell this to our veterans, it better be good enough for our family.
Absolutely. Yes.
And it is. And it's these resources that we're talking about, I use in my house daily. So I'm really excited as we start to get into that.
I mean, a Marine family, you need as much as you can get. So
Oh my goodness.
I mean, you need about as much help as you can get. So.
Well, all right.
I'm sorry, I was Army over here, so yeah,
Oh.
not a jarhead.
Yes, but if the world is ending,
yes,
I want my husband on board.
sure,
That's all.
sure,
That's fair
exactly,
enough.
exactly. When
No.
there's like one mission and you can just keep feeding him boxes of crayons as it goes along, correct?
I think all services are important. My family
Yes,
has
I
Army,
jest.
Navy, and we have a lot of joking that goes on.
Yeah, I jest.
Yes.
No, everyone serves their purpose, even the Marines, unfortunately.
And even civilians like myself.
Yes, even civilians serve their purpose. That's correct. Okay, so we talked about a little bit about what whole health is, which is great. We talked about health coaches, which I think that it's a really interesting idea, and at least someone to guide you through the whole process of really getting to know yourself or getting to know what you like. You know, I tell people a lot that veterans, let's say 93% of us, okay, are followers. As veterans, right? Like we've never been in a leadership role. We never had to be in a leadership role. Some people came in, did like 3 years or 4 years, and then they were out, right? And so they never made it to like that whole NCO or a non-commissioned officer, you know, mentality or role of being in charge of people. And so not being in charge of people, then you start not being in charge of yourself, because then it's very institutionalizing being in the military. And so that's why I said, you know, having this kind of coach might be really good, because it's like you get out of service and you don't know who you are anymore. Right? Like when you go to make that transition, you're like, okay, who am I now? Right. Because I used to be this person that wore all these badges and I had this uniform and I had stripes and I had rank and I had authority and I had this, but now you're nothing when you get out.
Well, I'm not sure I would agree with that, because what I would say is, yes, that was a role that you played and you played it very efficiently. Mm-hmm. But now your responsibility always has been and will continue to be towards yourself. That's the reason the whole health circle, if you look at it, puts you right in the middle, and it says me. And then it talks about being mindful and being aware. So I love the way you said it, because I think this is the area where you hit the pause button and say, you know what, I'm going to change that focus and I'm going to find that leader in me. I may not have a rank attached to it. It may not have a title attached to it, but it's the leader of my own self. And that puts me in the center. I'm aware of myself. I'm mindful of what I am. And then these are the things that revolve around me, which are important for me. It's family, it's co-workers, it's my health, it's my sleep, it's my meditation, it's what I eat, it's what I do to get relaxation. And all of these things, I want to see which of these matter the most and how I can get the maximum out of it, because I am now going to lead my life the way I want it.
And the truth is, the sobering truth is that the illness that we encounter in the clinics and that we face as human beings, over 65% of it is caused by ourselves, our health behaviors.
Absolutely.
And so whether we like it or not, we need to get to know ourselves. It is imperative that we support our veterans to get to know who they are, what drives them, because health behavior change requires that you be interested, that it means something to you, that it be important, or else research shows you're not going to do it if it doesn't matter to you. And we have to start changing if we want to get healthier.
Yeah, I couldn't have said it better myself. I stress advocacy for, you know, veterans to advocate for themselves all the time.
Absolutely.
And you know, I'll send them to certain processes at the VA to where they'll say, okay, listen, I've already tried that process and it's failed me multiple times. And I said, yeah, but that's not the point. The point is not if it fails you, okay? The point is that we have a system in place and we need it to fail, right? Because you can't learn from something unless you know that it's failed, okay? And so that's you advocating for yourself. It's you advocating for another veteran, right? Like you're going through the processes that have been set up in place for us as veterans. And if they fail, well, then we need to prove that they don't work, right? And so that we have to keep using it. And that is advocation for yourself. And then getting to know yourself. You're absolutely correct. Getting to know yourself, I think, is paramount in anybody's recovery from anything.
Absolutely.
Is really getting to know yourself. It's very difficult to do, and not many people want to do it, especially in the military. We have this mentality of very self-sacrificing mentality, right? So we don't really put a lot of value on ourselves or what we want. That's just not how we're trained. I mean, we're trained on what does the people need from me, right? Like, what does my boss need from me? What does my commander need from me? What does this group of people that we're serving overseas need from me, right? And that's what our mentality is at. It's not what do we need from these people, which I think is, but it's good. And I think that it's healthy. I think it's extremely healthy.
But let me tell you this. So when I started at the VA about 5 years ago, and remember I said I came from a civilian setup for almost 18 years. One of the things I was impressed during my orientation training, there's pointers that have stuck with me. And one of the pointers stuck with me was, veterans are a group of people that do not do not entertain, do not appreciate the word failure, right? So I see that as such an empowering message when whole health comes through, because that's what it talks about, right? What it's saying is, I'm not going to let myself fail. I'm going to be first and foremost true to myself. And if I'm true to myself, I'm putting myself in the prime position. What are the ways that I can keep myself available to me? What are the ways I can be there for myself? Things that are important, things that make me go. So do not take no for an answer. And the resources that we offer through the whole health programs are basically designed to address all those different aspects in your life that are important, not to accept failure.
Yeah, I tell veterans, I use an analogy all the time because I think most veterans are picture people. I don't want to say just Marines, but it's Army too. I mean, we're picture people. So I always try to paint a picture. And what I always use is the I tell people, do you know what lifeguard training is involved? Like, what's involved in lifeguard training? And I said, day one in lifeguard training, they usually teach you how to curl up your knuckle and punch someone as hard as you can in the kidney. And everyone's like, why would they teach you that? Like, it's a lifeguard. Like, you're a lifeguard at a pool or something, right?
Wow.
And you're sitting there and you're like, okay, why would you need to learn how to punch someone in the kidney? That seems counterproductive.
Intense. It seems intense.
It seems intense, right? But it's the greatest way to give a human being enough kind of like, jolt to kind of let go of you, right? And the whole purpose is if you jump into a pool as a lifeguard and you go to try to save someone's life and they latch onto you so tightly that they're going to take both of you down.
Wow.
Right. So like you can't save another person until you save yourself. Like you're not able to help other people until you started helping yourself.
Right.
And it's the main kind of characteristic, or it's the main trait that I've always tried to instill in veterans that I meet, because they always are thinking about other people first. And I'm like, listen, you cannot take care of other people efficiently if you're not taking care of yourself. Right. And so I love when the VA really kind of nails it on the head with certain programs like Whole Health. To where it's basically saying, listen, this is not just for your mental health and well-being, right? This is also for your physical health and well-being, and your spiritual health and well-being, and all these other different aspects.
Absolutely. Your communication, your connections, your relationships. And here's the deal. Look, I think one of the things, somebody asked me, what was my biggest takeaway from 18 years of working in the private sector? Living in the greatest country in this world with probably the best healthcare system, but why are we not where we should be? Because we've not yet hit the mark in terms of having a partnership when it comes to healthcare. The partnership starts with me, if it's about me, connecting to myself, and then partnering with the people who are facilitating me to maintain that health. And that partnership can only come if I'm looking at different aspects of what affect my health, and then engaging every aspect to the way that needs to be engaged. And for that, the resources are out there. Resources that you can engage right from the comfort of your home. So you don't always have to be in a facility, in a building, in front of somebody. There's so many things you can do in the comfort of your home at your pace. And that's the idea of whole health.
Mike, do you think that your listeners would be interested in the $1 million question that will connect you to what Dr. Haideri's talking about?
Sure.
All right. Are you all ready? It is, what matters most to you?
Absolutely.
That is the foundational question. And research shows if we can identify, if your listeners can identify, if you can identify what matters most to you and you connect it to your health, you will be winning. And so I hope you will think about that today. What matters most to you?
I love it. I love what you just said, because if you think about it in one line, that is the change which whole health is bringing to us. I mean, take it from me as a doctor. The question that we've always taught all these years is to ask somebody sitting across, whether it's a veteran or a civilian. What's the question we used to ask? What is the matter with you? Nope. The question is what Karla just asked. What matters to you? Because this is about you.
Yeah. Well said. So when is the rest of the VA going to get on board?
Well,
You're right.
We are in the business of cultural transformation.
There we go.
The
Such a good answer. That was so good.
We're trying.
I know,
And the thing is we need you.
Yeah.
We need our audience, your audience,
Right.
to start
Absolutely.
asking yourself what matters to you. Bring it to the table. Start bringing yourself to the healthcare table, because you are the expert of you. And if you don't show up with your clinician and bring yourself to the table, then we can't make all of this come true.
Amen. And to talk about the change and when everybody else will be on board. I was just telling a student yesterday, anything that changes overnight, unfortunately, is a fad. And, fads don't last. What we're trying to do is a mindset change. And the mindset change will come from you first connecting to yourself, as Karla said it beautifully, bringing yourself and then engaging the people that are involved with your healthcare facilitation, whether it's your nurse, whether it's your doctor, whether it's a social worker, whether it's anybody that you come in contact, whether it's a colleague, whether it's one of your servicemen that you were with. Connect, ask each other, what's getting you motivated? It's about all of us being involved together, but also starting individually.
I know I had to ask you that question. I'm so sorry.
No, you need to. You need to ask.
that's a great
but
question.
it's a serious question.
That's a great question.
We have to be patient, but trust. I just rushed over here today, coming from teaching a class, teaching providers, nurses, pharmacists. How do you get your patient at the center of the table? How do you communicate?
Absolutely.
So please know that the VA is investing in their staff, and we may not be actualizing all of this right away, but we're working on it.
Yeah.
Right.
No, it's always great to hear. And I tell people the same thing all the time about the VA is that, I always say I'm 60-40 pro VA, right? Because I feel like it's a very realistic output, okay, of the VA 60% of the time is doing great and wondrous things, right? And you can trust the VA to do great and wondrous things about 60% of the time. And then 40% of the time, we have some opportunities, opportunities for change, right?
Absolutely.
And so, yeah, I think that this is great. I think this is wonderful, honestly.
And honestly, the biggest shout out I want to give, besides all the great listeners that you have online, is to also, especially when it comes to VA North Texas, is to those 1/3 of our employees are veterans. And if we start just there, look at how big an impact we're going to make. Because we talk about a burnout that's going out with healthcare workers. Well, the burnout can start extinguishing itself if our veterans, who are also our workforce, start to first take care of themselves. And we are there to empower that.
Yeah. No, yeah, I agree. Anything else to say about that? Your answer was so good. I literally hit you with an off the spot question.
Can I drop the mic?
Yeah. your question was so.
No,
your answer was so good.
She was, yes.
Well, I have to answer it a lot.
Okay.
But I just also want to remind that while the VA, we hold responsibility, but so does our veteran.
Yes.
And I like to share.
Preach.
I say this all the time to our veterans. You come to us maybe 2 to 3 hours a year, but you're on your own 8,733 hours. What's going on during that time? If we know that 65% of illness is happening because of what we do, it's important to look at that.
Yeah, absolutely.
That's
a majority of
the
majority of the veterans that I talk to do an outreach, from the hospital. We talk to a lot of veterans, and we go to a lot of events. We go to a lot of different veteran organized things. We talk to a lot of veterans, and the most common thing that we can find, the most common thread, is that veterans, some are out there advocating for themselves and getting everything that they need from healthcare and from the VA. And some of them are out there doing absolutely nothing for themselves, which is sad, which is really sad. And you know, we try to convince them like, hey, just speak up, say something, right? Like say anything. Like if we don't exactly, yeah. Like if we don't know that something's bothering you, like how are we supposed to fix it, right? Or if we don't know that something's wrong with the VA, how are we supposed to fix it? It never stops being an advocation for yourself and your health and your well-being and the systems that are in place to help take care of all those things as well.
And you could be a role model. Now, I remember you saying earlier that this program, you know, I'm amazed and I'm impressed at how far you're making this go. But this program is going to 40 counties. Now, let's say there's only one person per county who gets it. That one person could be the flag bearer, the person who starts that program by saying, okay, I get it. I understand it. I want to follow this, but I will also inspire others. Yeah. And then we start spreading it. That's how it goes.
Yeah, what a way to find another renewed sense of purpose, right?
Yeah, absolutely.
Because I know that's a big thing with veterans too, is us finding a new sense of purpose when we've transitioned, right? We need to find that sense of purpose. But that could be your sense of purpose.
Yes.
You could find something that you really believe in, like the whole health program or something like that, and then be the flag bearer for your county.
Absolutely.
That's a great idea.
I know. I love it. That's another mic drop.
I know. Maybe you should have those.
I had to do something after you did it.
I know. Y'all should be.
I think you took what I did. It was like boom.
You should be taking note. Everyone should be taking notes here.
I'm taking notes.
It's okay. This is like technically it's videography notes. Yeah. Okay. It's videoed notes. Well, great. That's awesome. Okay. So last question that I have for you. How does one get started with the whole health program? Because that's I think it's great that we have an app. I think it's cool that we have a health coach. I think it's great that we have all these things. But if I'm a veteran, okay, and I'm starting from square one, let's say with the VA, what do I do? Who do I talk to? How do I get involved?
So I'll give you the boring answer for that, and then Karla will give you the fun answer.
Okay. Because you know, no pressure.
Okay,
great.
So the boring answer is the obvious answer, which is, as a doctor, my answer is very plain. The next time you are with your healthcare provider's office, talk to your nurse, talk to your healthcare provider, ask them about whole health. If they don't know enough, I guarantee you your interest is going to kindle a desire for them to get that information for you, because curiosity in you is going to generate curiosity in them. So you could start that process by starting with your immediate healthcare provider. But then beyond that, there are so many resources that's available to you where you can get inquisitive about it, and that's where Karla can help, right?
All right, I will do my best. Mike has promised me that in the show notes, he's going to include a few web addresses.
I will in the description.
Awesome. In the description, you will get access to the following two things. Did you know that the VA has a Harvard grade library, like WebMD, but for veterans?
No.
Well, that's one of the resources that I want to share. It's called the Veterans Health Library. It's A to Z. And then first thing our veterans can do is go on there, and instead of going on Dr. Google and Facebook and the neighbor and YouTube, go here where you can get real evidence-based information in non-medical language to learn about yourself, learn about your health conditions, learn about your risks, so that when you go to your doctor or your nurse or your pharmacist or psychologist, you can come informed with questions. That, I think, is one of the first steps. And number two, connect to, we have over 50 health apps. The VA has created over 50 health apps.
We have quite a bit, yes.
Great. I'm so glad you know. So find the one you like and start to work on your health yourself. So if you want to work on weight loss, we have the Move Coach, which is the #1 weight loss program in the country based on research over Weight Watchers.
Absolutely.
Yeah. Yes. And then we have Live Whole Health, which is like your own health coach in your hand. That would be my suggestion, is really start to connect to the resources that are available. They're award-winning. They're awesome.
Great. Those are good answers.
Right.
I mean, that's the answer that you said is the answer that I would normally tell everybody. And like, listen, your primary care is your gateway. You're the gatekeeper to everything in the VA is your primary care doctor.
Absolutely.
So if you're not talking to your primary care doctor about things that you're interested in or things that you want to do, you're wrong. And and if you are and they don't understand what's going on, or you're asking them questions that you know is a program that the VA offers, and they have no idea what's going on, then you need to keep pushing it, because eventually they need to learn it from somewhere. Absolutely. And they'll eventually reach out to colleagues, like you were saying, right? They'll reach out to colleagues and they'll figure it out.
Right. They have the resources.
Yeah.
And we love our veterans, because not only do we respect what you have done for us, but we love the fact that you have faith in our system. And, give us a chance to prove that we care. And, if we're not doing it right for the first time, stay at it, and we will. It's change. We will bring the change. We are in the process of making it better every day.
I love that. That's awesome.
Any last words?
Be my doctor, Dr. Haideri. I want in.
He's over at Bonham, right? You're at Bonham?
I'm at Bonham and Plano, yes.
Way out there.
Way out
in
there.
the sticks.
We'll try.
Just in the sticks.
Well, it's a great
Bonham.
campus. It's a lovely campus.
It is. I know. I equate every VA. I use this joke. I don't know if you ever seen The Lord of the Rings. Anybody ever watched? Mm-hmm. You have? Okay,
Absolutely.
great. So I usually call every main VA campus the Eye of Sauron, right? And I said the farther away from the eye that you are, like the Shire is, okay, in the movies, then the greater the expectation that you can have of the VA.
That's
yeah.
interesting.
Because it's farther from the eye. Unless you do something wrong at that location and the eye turns.
Ah.
Right?
Okay, this is all good to know.
Yes.
I'm taking notes, Mike.
That's right. Good. Take notes. Take notes. All right. Well, great. Thank you so much. I really do appreciate you for being on. I think this is an awesome conversation to have. I think this is great for veterans to really kind of sink their teeth into. I think it's something that they should take and kind of progress forward with this information too. And they should really kind of delve in and just kind of see if it's for them.
All right. Thank you for the opportunity, Mike.
Thank you. Thank you for the opportunity.
Yeah, no, it's my pleasure. Honestly, it really is. It's my pleasure. All right, sweet. Well, thank you so much, everyone. Oh, I don't have a camera. I went to look at a camera. I don't have one today. All right, everyone. That's all that I got for you for this episode. Thank you so much. Thank you, Dr. Haideri. Thank you, Karla, right?
Yes,
thank you, Karla.
awesome. You got it.
I appreciate it. And listen, please, for the love of God, go down to the comment section and comment anything. I don't care if you even hate me, or you hate my voice, or you hate the podcast, or you love it. I don't care what it is. Just comment, please. Please, for the love of God, and subscribe. All right, and that's all that we got for you. So thank you so much. And as always, remember, no matter how bad it seems to be, just Charlie Mike.
I believe what I